can't imagine there's a person in this room who doesn't know who Bob is. But nonetheless, I have an introduction to give. Bob, of course, is the CEO of Hackensack Meridian Health, which is New Jersey's largest and most comprehensive health network. I know we have many employees here with 17 hospitals, 500 patient care locations throughout the state, and I just learned this morning over 30,000 employees. Under Bob's visionary leadership, the network is making major strides in innovating treatment and advancing research and medical education. Certainly, as was mentioned from the voice of God, the Hackensack Meridian School of Medicine at Seton Hall University, of which I am a proud board member wearing my pin, is really receiving national accolades for transforming the training of future physicians to thrive in a new state of healthcare. It is very exciting. It's an exciting time for that university. The network's merger with Carrier Clinic, and in my mind, that was the most exciting thing of the many exciting things in 2019, is advancing behavioral health care by helping many more people receive high quality and, most importantly, compassionate care. And this is an area that has been so neglected by other healthcare outfits. Next week, Bob, who is also an international figure, is off to the World Economic Forum in Davos to share his insights with the global community on new approaches in the treatment of mental health and addiction, and they've just added cybersecurity to that agenda. Bob's commitment to improving healthcare has resulted in national recognition, including most recently being included in Modern Healthcare's 50 most influential healthcare leaders, not in New Jersey, but in America. Bob, it is such a pleasure. Thank you for your leadership. Please join me in welcoming Bob Garrett.
Thank you, Linda, for that amazing introduction. And I think we should give Linda a round of applause because Linda serves on with so many important causes. She's on a lot of very, very key boards around the state, and she's been a true business leader for our state. So, Linda, congratulations on everything that you've done. Linda mentioned the modern healthcare list, and I always have to tell the story. So when you get on a list like that, everybody's so happy in the office and you get all these high fives and you're feeling really, really great. And then I travel home. And I say to my wife, I said, guess what? I got on this modern healthcare, top healthcare leaders list in the nation and all that. And she goes, that's really nice, honey, but tonight's garbage night. Can you take out the garbage? True. But at any rate, it is an absolute pleasure to be here. I'd like to welcome all of you to the great JFK Medical Center, part of Hackensack Meridian Health. And how about a shout out to the JFK team? It's now my distinct honor to introduce Governor Phil Murphy, the 56th governor of New Jersey. The governor has been such a strong advocate and supporter of so many innovations that will improve the overall health of the residents of New Jersey. And I've seen it firsthand, first before he became governor and then after he's become governor. He's really very, very passionate about healthcare. His State of the State address that just happened this week, a lot of that was dedicated to healthcare initiatives and healthcare legislation, and we're very, very appreciative of that. As an example, the governor and the First Lady are determined to dramatically improve outcomes for moms and babies in New Jersey, especially those coming from disadvantaged environments and underserved communities. And at Hackensack Meridian, we really applaud that effort. We've joined that effort, and it is a very, very important effort. And I really want to thank the governor and the First Lady for their leadership on that issue. The governor has supported so many initiatives to improve and better coordinate behavioral health. Linda mentioned behavioral health. It's such an important issue. If we don't get at improving behavioral health, we're not going to, I believe, improve the overall health status of the communities that we serve. So I applaud the governor for his efforts on behavioral health. The governor's also stated, and he's made it a priority of his administration, to make New Jersey a leader again in technology and innovation. And to that end, I really appreciate the governor's support for many of the initiatives that are innovative at Hackensack Meridian. And he was on hand to dedicate our new Center for Discovery and Innovation, where discovery, innovation, and research is going on each and every day to try to find tomorrow's cures today. So I really applaud the governor for everything that he's done in a very short period of time, but his focus on healthcare is just amazing, and we really appreciate it in the healthcare community. So ladies and gentlemen, I want to welcome a true friend of the healthcare community and a true friend of Hackensack Meridian Health, Governor Phil Murphy.
Thanks, Bob. Appreciate that very much. We're back again.
Yeah, I know, we're
We
back.
have to take this on the road. We doing a photo?
Yeah.
Let's go.
Okay.
Thank you. Hello, Gordon.
Have a seat.
See you, man. Good morning, everybody.
So welcome, good morning, Governor, great to see you.
Nice
Happy
to
New
be here,
Year.
Linda.
The Governor and I had a lot of fun doing this back in October in South Jersey, so delighted to be back with you.
Very happy to
We
be
have
here.
an hour together. And so what we're hoping in this hour is to ask some thought-provoking questions, some questions that where we may get to dig a little bit deeper and perhaps allow the audience to leave with some new insights. But first things first, and Governor, this is directed to you, but ultimately, Bob, I'd love to hear your thoughts. We understand you signed some health care legislation today. So not only is that an important announcement, but can you tell us what you signed? And
Absolutely.
how it'll affect New Jersey?
You betcha. First of all, very happy to be here. So I want to thank the Hackensack Meridian family and JFK Medical in particular for hosting us this morning. I want to thank two very good friends, Linda and Bob, who are leaders across a whole spectrum of interests in our state, and especially, obviously, most importantly, healthcare. So I'm really humbled to be here. This is an incredible setup.
It really is, yeah.
I feel like we're declaring war or something up here, but please God, that was not one of the bills I signed today.
Hey, Governor, the logos are new just for you.
Oh, look at the logos. Yeah.
Look good, right?
Very, very productive. They're on your little button there. I
absolutely.
saw too. So great to be here. A more general answer, Linda, and then specific to the bills. So the more general answer is healthcare affordability, access to healthcare. We have some of the best research, treatments, hospitals, not just in the country, in the world, and Hackensack is right up there at the head of the class. That's all great, but whether you're a family, whether you're a business, whether you're an individual, it's just too darn expensive in too many cases and hard to access. So our job is to keep, collectively, the quality high, have New Jersey still be the place where folks come to get treatment, to do research, but to make sure we can make this a right, not a privilege for everybody. So here. So that's the general frame that sort of drives our actions. Second one, sadly, is that the Affordable Care Act, which has been a game changer in our state. This guy knows it. So many, Gordon and others here, know this far better than I, but it's been a game changer. It's not perfect, by the way, and even President Obama would say if he were standing up here that it is not perfect. But we're more than halfway up the mountain, and it's made a huge difference for so many lives in our state. Let's make sure we don't slip back down that mountain. And sadly, in Washington, the Trump administration has done everything in its power to try to dismantle the Affordable Care Act. In the first 2 years, in concert with a Republican, and I'm not trying to be partisan, just a fact, in concert with a Republican leadership in Congress in both houses, and then for all 3 years through the courts. And so the bills, back to the answer of your question, the bills I signed today, which I'm incredibly proud to have signed, are 9 bills which essentially codify the important elements of the Affordable Care Act into New Jersey state law. And these are big deal game changers so that we won't wake up one day and find out something like pre-existing conditions all of a sudden is a different reality. Or that right now Johnny and Sally can stay on their mom's insurance programs till they're 26, that they don't wake up someday and that reality is gone away. Or the sort of essential medical benefits, probably most importantly, like emergency care, maternity, or unfettered access to contraception. So it's a little bit in the similar rationale as to why we're building our own healthcare exchange. We're too exposed if we're relying on an unsettled, if not hostile, reality in Washington. We have to protect ourselves. This informs a lot of our actions, where we are either, the three verbs are mitigate, compensate, litigate, or all of the above. But we want to make sure that we are protecting the 9 million folks who call this great state their home, and that they don't wake up one day and find out that their health care has been stripped away from them. So that's longer than you probably wanted, but there are 9 different bills. I can go through them in chapter and verse. I have a little bit of a Joe McCarthy moment. I've got the facts right here if you want to get into it, but I've given you some of the big highlights.
Thank you, Governor. And obviously, Bob, you're on the other side of the fence with this, so you'll be ultimately the executor and the leader here. So we'd love to hear your thoughts.
Yeah,
as
I mean,
well.
I applaud the governor for signing these pieces of legislation, because I'm a strong believer that we need to build on the Affordable Care Act. We need to first protect it, as the governor has said. That's really important, and then we need to build on it as well. I agree with the governor. It hasn't accomplished everything maybe it set out to, but boy, I tell you what, we're in much a better state in healthcare with it than we were before it. In New Jersey alone, I think it's the number is about 800,000 New Jerseyans now have insurance, either through the exchanges that were established or through the expansion of the Medicaid program, that didn't have insurance before. And they ended up in our emergency departments without insurance, without primary care doctors. So there's no doubt it's made a big difference. And some of those provisions, are very, very important. So I really applaud the governor for doing this. And I want to, I'm not in favor of throwing out the baby with the bathwater. I'm really in favor of building on the successes of the Affordable Care Act, and maybe where it fell a little short, let's go back to the table and add to it. But let's not go back in time. That doesn't serve our state, doesn't serve the country well. And so I think that the legislation you signed will make a profound difference. And what's going on in Washington, who knows what's going to happen? So we got to take care of our own. So I applaud the governor for doing just that.
Thank you, Bob. I should say one other thing. I can take some action on my own, executive orders, but overwhelmingly, if you look at the comparison of bills that we've signed to executive orders, it's probably now 6 or 7 to 1. It takes a village. I can't sign a bill that the legislators didn't put together, work with our teams and their teams together, and pass and send to me. So I want to give a big shout out to a broad range of legislators who sponsored these 9 bills.
It's great, and it's exciting. Very good.
Amen.
And this actually brings us to what I find to be a very, very troubling question. In the past 3 years, not only in the state but across the country, life expectancies have declined. Yeah. And some of the reasons that are on the rise, drug overdose, suicide, cirrhosis of the liver, adverse childhood experiences, the so-called diseases of despair. How do we combat this in our state, and what does this mean from both a health and an economic policy standpoint?
Do you want me to jump in?
Sure.
And I'm very curious, because I know this is important to Bob and the Hackensack team. I know Gordon is chair here. Gordon, it's great to see you, and a lot of board members who are here. The leadership that you all show, including in the broader societal stuff, is really important. I mean, a couple of things occur to me. And number one, and I mentioned this in my State of the State a couple of days ago, but getting at sources of depression, suicide, treating mental health issues on par and in parity with physical health issues. That's a model that we need to aggressively continue to get to. I'd say 2 things in specific. One is there is, and I know Bob shares this, there is a much broader societal reality that goes well beyond the specifics of what we may be doing inside the specific realm of healthcare and treatments, whether they be mental or physical. A study came out not just a few days ago that compared the increase in minimum wage to a reduction in suicides. In our opioid, and I'll come back to that in 1 second, in our opioid approach, which has 4 legs to the stool, one of which is societal, housing, employment, I mentioned wages. We can't ignore the broader societal context beyond the specific healthcare realities or steps that we will take to address that. Opioids is a big contributor, Linda, to your question. We had, as far as we can tell, 3,021 deaths from opioids last year, which is, on the one hand, a 3.3% decline, and this is on the heels of several years in a row where we saw double-digit percentage increases. So I guess the glass half full says we think the package, the approach, the $100 million that we're spending every year on data, on treatment, on the societal stuff, on law enforcement is bending the curve. But I would also at the same time say 3,021 lives lost is 3,021 lives too many. That's by the way, plus or minus a 9/11 every year. And we're no different than a lot of states in New Jersey. We think we've got the right playbook. We think the elements of our plan are beginning to show signs of promise, bending that curve, but we won't rest until we get that down to zero or as close to zero as possible.
Well, and thank you, Governor, for that. And Bob, obviously, you've put a real stake in the ground with the carrier merger. To think that the governor's citing some statistics, but I would add 1 in 5 people in the United States have mental illness. The suicide rate in the past 20 years is up 33%. And so we applaud the commitment you've made, and maybe you can tell us a little bit more about that.
Sure, I'm glad to. The statistics are really staggering. It's 1 in 5 in the nation that have mental illness. But globally, there's a billion people in the world who have a mental illness or a addiction disorder, and sadly, 2/3 of those people are not getting help. And it could be a variety of reasons. It could be the stigma that's associated with mental illness. It could be education. It could be a lack of access to care. It's probably all of the above. But, beyond the statistics, we really need to address this issue because it's a huge global issue. It has so much impact. So you mentioned the carrier clinic, and what we wanted to do at Hackensack Meridian is we wanted to step up and really be a leader in addressing access for behavioral health patients, in addressing innovation that we could potentially put into practice to get treatment more effective and to get people treated and screened earlier. And we found a partner with the Carrier Clinic, one of the leaders really in behavioral health across the nation. And I'm really proud that in a short time, in a year, since we finalized that merger, that we've made some great progress. I'll give you a couple examples. So in this past summer, we opened up what is the state's, and I believe that probably the nation's first behavioral health urgent care center. And why is that important? Because people in crisis before urgent care, people in crisis who had mental illness or addiction disorders typically would end up in a complex and crowded emergency department. And think about it. They're competing with patients who just came in with a heart attack or just had a stroke or were involved in a motor vehicle accident. And they can sometimes be there for hours until their issue is addressed. With urgent care, the concept is, to make it as convenient as possible in local communities, and we opened the first one in Neptune, New Jersey this summer, as I said. The idea is that they can be seen, these patients can be seen within minutes by a behavioral health specialist, and if they need a consultation with a psychiatrist through technology, through telepsychiatry, telehealth, they can have that consultation and then get referred to, if they need follow-up care, they can get referred to the appropriate provider, or if they need hospitalization, they would be transported right from the center to a hospital. Already, hundreds and hundreds of people have been helped by this concept. I think it's going to be the model of care, across the nation. So that wouldn't have happened without the collaboration with the Carrier Clinic that we put into place. Another good example is we're building, and it should be open by the end of this year, a state-of-the-art addiction treatment center in northern New Jersey, up in Mahwah. And too many New Jerseyans today have to travel out of the state to receive addiction treatment services. Many of them are traveling long distances. They're going to Florida, Arizona. I have to tell you, we're not hearing great things about some of those experiences. So we're building a comprehensive center with a carrier clinic. It'll be inpatient residential beds as well as a host of outpatient services. And we think it can rival the best that's out there in the nation, like the Betty Ford clinics of the nation. And that I think will be a real game changer. And then the last thing I wanted to say that I think, you know, it's a good example of where you know, we all can partner, where government and providers like Hackensack Meridian can partner. We're leading an effort. It's called the Pediatric Behavioral Health Collaborative. And 500 pediatricians around the state are participating in this effort. So when the idea is when children are being seen for, you know, healthy visits, their annual visits to the pediatrician, they're also being screened for behavioral health issues and potentially mental diagnosis of mental illness or addiction disorders. 165,000 children have already been screened in just the last couple of years, and 10,000 have been referred for follow-up care. It's making a huge difference. It's being funded by state of New Jersey and by the federal government. Other health systems have joined, so we're not the only ones involved in it. And this is I think a great example of collaboration and early intervention. And I think about it, and I think you think about all the violence around the country, whether it's in schools or places of worship or even in hospitals. And you know, hopefully by this early intervention, we can avoid some of that down the road.
You know, it's interesting because you've each alluded to the economic aspect of this. Clearly, this is the right thing to do. Clearly, there's altruism involved, but we've seen other health organizations close their behavioral health units because they did not feel it was profitable. So again, I have to applaud you and your organization, Bob. And the other aspect is the cost of ultimately treating these diseases of despair far outweigh, I think, any kind of negative action from a profit motivation.
The cost issue is significant. I mean, the urgent care that we've established, the Behavioral Health Urgent Care Center, the costs are 70% less than if those patients went through the emergency department. So that's a big issue. And I do want to give a shout out and you know, some recognition to our board, because you know what, you're right. Without the support of our board, and that was courageous of our board to really want to make behavioral health a top priority for Hackensack Meridian. Many of the board members are here, starting from Gordon Litwin, our chair, but I want to give them a round of applause.
Thank you. That was, I so appreciated the answers each of you gave. I'm going to shift to something a little lighter and something I know is so near and dear to each of your hearts, and that's innovation. Bob, certainly from being on one of your boards, I know how passionate you are on that topic within Hackensack Meridian. Governor, I've heard you many times talk about what innovation can do for the state. So I'd like each of you to talk a little bit about how to build that innovation culture and really what that could mean for us and what's on your wish list.
Let me dive in.
We always defer to you first.
Okay, that's all right. That's all right. We are the state of innovation. You've heard me say more times than you probably would admit that we were Silicon Valley before there was a Silicon Valley. We lost our edge, we're getting it back. And the great news is we start in a very good place. So if you ask yourself, I've got an aspiration to get to some place, what's the raw material that I've got at my disposal in order to get there? Even though we may have lost our edge, boy, we are loaded with raw material. And I'd much rather have the raw material and embark on that journey than otherwise. Raw material begins with safest hospital systems in America as rated. Without question, as I said earlier, some of the finest and most important research treatments, healthcare more broadly. And by the way, when I say innovation, it's not just technology and telecom. It very much is bio, pharmaceutical, healthcare more broadly. We have the #1 rated public education system as of September at long last in America. We are based on SAT subject test #1 in physics, #2 in chemistry. We have, and I think this says a lot about our mindset as a state, our curiosity. We have the highest level of participation in K through 12 of foreign languages of any state in America, and it's not even close. We were just rated as the smartest state in America.
Feeling good about that.
I don't believe I was part of the sample size, but I feel smarter already. We have the highest concentration of scientists and engineers per square mile in the world. So that is great raw material. We've got a location second to none. And so we are all in on the innovation economy. And that includes a lot of collaboration in the healthcare arena. I've been honored to visit your, I don't know which community or county I should lead with, but I'll say Nutley,
Yes.
Just to give a shout out to Nutley today. But Clifton or Passaic or Essex counties are also, you've got a very complicated geography up there. But 2 towns and 2 counties. I can only imagine the permitting probably takes a century. But you've got an extraordinary campus there, which we are all in, including a medical school, which I know you're on the board of. We've got the hub in New Brunswick, which is going to be, we'll be making big announcements on that soon. That's going to be up to eventually 4 million square feet in that big hole in New Brunswick, not terribly far from here. That'll be healthcare providers. It'll be Rutgers, Princeton, big companies, incubators, startup spaces. The amount of, give a shout out to the Economic Development Authority, what they're doing with the Angel Investor Tax Credit, the Tech Venture Fund, the Bioscience Center that they now have renamed and run, the deepening of higher education and healthcare providers generally, and then in these specific projects. Assemblywoman Nancy Pinkin is with us. Hi, Nancy. Thank you for coming and being here and for having us. The collaborations up and down, the emphasis we're putting on STEM education at all levels. We are all in the innovation space, and very importantly, that innovation space includes healthcare, right at center stage, in fact, of that. And we think there are huge 1 + 1 = 3 potential outcomes, and no one does it better than Hackensack Meridian. So, Bob, you should chime in.
Thank you. And now that you've told us that we're the smartest state, now I got a lot of pressure to give a smart answer,
Yes.
right?
We're all ears.
Yeah. So, and Governor, by the way, that project up in Clifton and Nutley and Passaic and Essex, we also, our partner was Seton Hall University, so we had 2 dioceses as well that we had to work with.
I forgot about that.
Just saying.
I forgot that.
Yeah.
I forgot that.
But innovation is very important to Hackensack Meridian, and also I want to take another opportunity to applaud the governor because he's been there for some of our major initiatives in innovation. So let me just give you a couple of them. The governor mentioned the School of Medicine, Nutley and Clifton. It literally is in those communities. And when we dedicated the school, we were not only happy and proud that it was the first new private medical school in New Jersey for 60 years, but what we're most proud of there is the innovation that's happened with the curriculum. And a couple of examples there that I think are making a huge difference, and I think it will really transform medical education. We have what we call a community immersion program. So medical students are required to, if you will, team up with or even adopt families during their 3 or 4 years of medical education in underserved areas throughout the state of New Jersey. They get to see firsthand some of those challenges that those families are having in staying healthy and how the social determinants play a big piece of staying healthy, how depression and behavioral health issues are affecting one's overall health. I think this is going to make for a more compassionate physician in the future, but one also that's going to be focused as much on prevention as in treatment. So I believe that's a real innovation. And listen, there's some great medical schools out there. There's places like Harvard and Yale, et cetera. But they've been doing it the same way for hundreds and hundreds of years. But when you have a startup school like the Hackensack Meridian School, you have an opportunity to really innovate, and I think we're really taking advantage of that opportunity. The governor was also on hand when we dedicated our Center for Discovery and Innovation this past year, and that's a great hub for research, discovery, and innovation. There's 3 major centers of excellence there. There's a Cancer and Infectious Disease Institute, there's an Institute for Multiple Myeloma, and one for restorative medicine. Restorative medicine is where through cellular therapies we can actually slow down the progression of chronic diseases, and even the aging process, which is near and dear to my heart. Same. But,
As smart as you are.
But we were the recipient recently of a $33 million NIH grant to develop a new generation of antibiotics, as an example, that hopefully will be more effective in treating these resistant diseases out there. So there's a lot of innovation going on right on that campus. And then the last example I'll mention, and it goes along the same lines of partnership, is a partnership that we've developed with the New Jersey Institute of Technology. We've created an innovation center. We have what we call the Bear's Den, which is kind of like the Shark's Tank, but we couldn't use that name, so we went with Bear's Den. And we're encouraging new ideas, new technologies, new companies that we're investing in. And the foresight of our board, we've established a $25 million innovation fund to make these strategic investments. We've made some already. But in addition to that, we're harnessing innovation on the front lines of our hospitals. So we have a Bear's Den at each hospital. And frontline team members, doctors, nurses, technicians, pharmacists are coming up with ideas. And you know what? They have some great ideas that we can put into practice. So, I applaud. I mean, we've been following the governor's lead on this innovation front. And I think we're making some good progress. But I do want to thank you for being there for some of those major developments.
I never say no. I think if we were to look in the mirror and be cold-bloodedly self-critical, where we have historically, in recent history, had dropped the ball, where I think we're making enormous progress in making up for lost time, are two areas. It wasn't that we didn't have great hospitals, great healthcare providers, great big pharmaceutical companies. We have more than any other state in America. AT&T may have moved its headquarters, but it still does the bulk of its research in New Jersey. I think we fell down in two areas, Linda. We took our eye off the ball as it relates to the startup culture. So we had too few of the Bear's Dens. We didn't really focus on the incubator opportunity. New York City cleaned our clock. And so startup is an area where we're all in and making up for lost time. And I love what I see, but with a ways to go. The other one, which kind of speaks to why we're all here today, we had really good silos, and we just didn't connect the dots well. If you look at the Boston success story, or the Northern California, and you and I have talked about this, or Research Triangle, or Austin, you've got a deepening in the relationship among the big healthcare providers, the big corporates, the big institutions of higher education. And the dots get connected very deeply in those places. We're now doing that here, and you're living it. I mean, the medical school, the innovation centers, getting folks into the same space, the same mentality together. I think there's enormous upside for us there.
People have ideas.
They do.
Why not try and capture them?
We're even capturing ideas from patients. We have an example of where we invested in a new company that a patient actually formed this company. He's a dialysis patient, and he designed a whole new line of attire that's focused on making dialysis patients and patients that are getting chemotherapy much more comfortable.
Yeah.
And it was pretty cool.
And I know you've had some nurses create some innovation as well.
We have, which is great. Yeah. And and I do, to pick up on, connecting the dots and all. I believe, if you're thinking about, businesses and companies and healthcare organizations, if you don't have that spirit of innovation, you're not going to be. I don't think you're going to be a healthy company. You're not going to survive over the long run. So it's really, really important that innovation really comes from all levels, and that's important. And, taking the lead from the governor, I think, a lot of companies are thinking about that.
I think it's ours. Oh, I'm sorry, Governor.
No, you mentioned nurses. I have to say this. I meant to say this earlier. For the first time in the history of our state, the commissioner of the Department of Health is a nurse, Judy Persicelli.
Oh, yay.
For the nurses out there. Sorry.
That's terrific. That's terrific.
And I want to give a shout out. She's terrific. She's absolutely amazing.
Are you here, Judy? I don't even know if Judy's here. She's not, but in absentia. If someone sees Judy, could you tell her we gave her a nice shout out?
Tell her she got some applause.
I got to say, Governor, if I could just say one thing about Judy, so unfortunately, we were the victim late last year in December of a cybersecurity attack that came from a foreign country. And Judy and her team at the Department of Health were amazing. Great support each and every day during that crisis. So.
You know, I have to, my observation is innovation is the thing that got you both most excited. So, and it's not a surprise. And thank you for that. So I'm going to shift the conversation to something that's a very highly charged discourse right now in our society, and that's the upcoming presidential election. So irrespective of political affiliation, of course, Governor, we know your political affiliation here, clearly we've been focusing on the state and what we can do in the state. We've touched a little bit on the Affordable Care Act, but I'd like to hear your thoughts in terms of what direction should the federal government take, because we can't do this totally.
Governor gets to go first on this one, right?
I don't go to Washington that often, but I'm going to catch a train right after this to go to Washington, so please keep me in your prayers. So a couple of things, and we'll try to be brief because they're showing us that the clock is ticking. First of all, I repeat something that I said earlier, but I think needs to be front of mind. We get mixed up too often, I think, in the debates between what's the principle versus what's the tactic to achieve that principle. And I think the principle is, and I don't think we can get there overnight. The ACA got us a lot closer, but we still have a road to travel. The principle, I think, continues to need to be health care is a right, not a privilege. Just like, who died and went to heaven and said K through 12 education is a right, not a privilege? I think likewise health care is a right, not a privilege. That to me is the guiding principle. How we get there, I think, we should be open to debate. I think Bob is of the same mind because we've each said it already. The Affordable Care Act has us more than halfway up the mountain. It's imperfect, but I think I'd rather be on the side of let's make that better as opposed to burn the mountain down and start over again. So I think that's important to say because you get these deep, passionate healthcare debates on stage, which are really good, but I think too often, I'm not a believer in these litmus tests. The litmus test for me is, do you believe that healthcare is a right, not a privilege? If you do, then let's get at a table, roll up our sleeves, and figure out over a reasonable amount of time and a cost that we can absorb, we can get there. Second and last point, the cost of health care is too high still. You hear that from everywhere. And so it's in our State of the State a couple of days ago, I announced we're setting up a single office of healthcare affordability and transparency, located literally in the governor's office. We're going to ask the Department of Banking and Insurance to get the data so that we can make informed decisions based on what the facts are. You just hear that all over the place, up and down, not just the state, but around the country. We have to be committed to transparency and affordability. Again, I think we start in a great place. There's no state in the nation I would even consider swapping out with our healthcare reality than in New Jersey. Is it perfect? It is not. Bob mentioned a lot of great work the First Lady and others in government and legislature and leaders like yourself are doing on the infant and maternal mortality crisis, particularly among African American mothers and kids in our state. So we have gaps still to fill in, but I wouldn't trade our hand with anybody. But the affordability and transparency of what I'm getting for what I'm paying, we've got to do better, and that's why we're going to establish that office.
Great.
So I would agree with those comments. I said it earlier too. I don't think we should be throwing out the baby with the bathwater. I don't think we should be repealing the Affordable Care Act. On the other side of it, I'm also not in favor of Medicare for all. I believe that that proposal would actually bankrupt about a third of the hospitals in the country because Medicare is paying at a rate much lower than the cost of care. So that's not necessarily the right solution. I think the governor has it right where we build on the Affordable Care Act. And if you look at what the Affordable Care Act has done already, it is there were two major areas, I think, which were the goals of the Affordable Care Act. One was to expand insurance coverage for Americans, and not perfect, but it certainly has. 30, 40 million more Americans are insured today than they were before the Affordable Care Act. More to go, but I think that's certainly in the right direction. Where it maybe fell a little short, that the goal was there, but the implementation maybe didn't happen, was on that issue of affordability, as the governor pointed out. I think what I'd like to see is that we get all the stakeholders together, build on the Affordable Care Act, and I'm talking about, government, I'm talking about hospitals, health systems, physicians, insurers, together, and let's develop a system where the incentives are aligned, where insurance companies and hospitals and health systems are rewarded for value, meaning better quality outcomes. Let's tackle maternal mortality, and if we do, we should be rewarded for doing that, as opposed to the system that exists today. The other thing that the Affordable Care Act said in its principles, and I think it needs to go to a whole new level, is the focus on prevention. Because if you look at some of the developed countries around the world where there was a focus on prevention, not only were obviously outcomes better, but it saved literally millions of dollars in healthcare costs. So I think those are a few of the principles that I'd like to see us build on the Affordable Care Act. And I know there are a couple of candidates that have been espousing that type of position, and I think they're right on.
Well, and that's a perfect segue into the next question. We've got about 15 minutes left, so we're going to focus on two questions. The next is really taking healthcare, and many people look at healthcare and think of hospitals and maybe research, but right on-site care. But it's such a much broader definition. There are so many auxiliary components: access to housing, food, water, jobs. And so, Governor, I'd love to hear what you're going to be doing to affect that broader definition, impact that broader definition of healthcare in our state.
I'd be glad to. I alluded to a little bit of this earlier. Just one more thing on the presidential, just to say simply, and again, I'm not trying to be partisan, we've got an administration now which is hostile to that principle that I laid out. We may not agree with the tactics, I don't want to speak for Bob, but any one of the folks on that debate stage would be supportive of that principle. And that's an important, this is a black and white choice that we'll have before us. So we alluded to this earlier, and this is why Hackensack Meridian has been such an important player here. It is well beyond the narrow definition of going to the doctor or going to the hospital. And I love the point you made on prevention. That's also one of the bills I signed today to make sure that we respect and protect preventative measures that folks are taking. This is societal. So I mentioned the opioid, just to pick that as an example, the opioid approach, the game plan that we have has four stools. Number one, we're Moneyball folks. What's the data? And we're not too proud to change our tactics based on the data. Two is treatment. Medical assistance treatment is the big piece of this, getting that much more distributed in doctors' offices. That's making a difference. By the way, on our suicide discussion earlier, 45% of the folks who commit suicide will have seen a doctor within the 30 days before they did that. So getting as much training, information, best practices into the hands of as many practitioners will move the needle. So it's data, it's treatment, it's law enforcement. So we won't talk about that today, but it's
another component.
hard edge, full throttle law enforcement. But it's importantly, the other stool is the societal stool. Jobs, housing, wages. I mentioned earlier this recent study, inverse correlation between increase in minimum wage and suicide rates. So it is really important that we have a state that has as many of those cylinders firing as possible, that this is a place where folks feel really good about being, that the quality of life works for them, that they can afford to be here, that they can have a job that pays a real wage and has real benefits, that they have access to housing in what is probably the most expensive housing state in America. So it's all of the above. It's why we announced yesterday something called Jobs NJ, to be better connecting companies who have their specific needs, particularly in the economy of tomorrow, overwhelmingly in the innovation space, including healthcare, and the folks who are looking for a job. Do they have the skills? How can we, as meaningfully as possible, shrink the gap and make it as seamless a match as possible? All of that. It's not one magic wand, Linda, I would say. It is a series of steps that we have to take across a whole range of interests that will strengthen our society and get right at that broader challenge that you lay out.
Absolutely. Bob, anything you want to add?
Yeah, I mean, I think, certainly, you said it. I mean, healthcare is not just about what goes on in a hospital. It's so much more than that. And more healthcare is really being provided outside the hospital. So I think it's important, and, at Hackensack Meridian, we're not certainly the only network that's done this. We've invested in a lot of facilities outside the hospital to provide better access to care and to provide health care that's more affordable. The governor has mentioned affordability and access as two major issues, and there's no doubt those are significant issues. So we have, as an example, at Hackensack Meridian, we have 500 locations now. That includes physicians' offices, it includes ambulatory care centers, urgent care centers, surgery centers, fitness and wellness centers, assisted living, and then on the post-acute care side, which is very important as well, nursing homes, rehab centers, subacute care facilities. That's very, very important to have the full continuum of care. It provides for better access because people have health care right in their local communities. They don't have to necessarily travel to a hospital, but it also makes health care much more affordable. And then the other piece is really prevention, and that's a big part of our mission too, is to make sure that the communities that we serve are healthier. And that's where, population health comes in, and a focus on those social determinants of health that you spoke about in your question. It could be food insecurities, it could be housing and transportation. As I mentioned, at the medical school level, where, our medical students are getting exposed to that. But beyond that, we have to do more. And there's been a lot of, I think there's been a lot of what I would call one-off initiatives that have gone on, and health systems have they partnered with a housing agency or with a transportation company to improve certain communities. But I think we need to really embed it in our culture and make it a major strategy. So just this year, Hackensack Meridian has made the social determinants of health one of our 7 key strategic initiatives. And we've hired a firm, and it doesn't get better than this, the Institute for Healthcare Improvement, Don Berwick, who heads that up. He's the guru on transformation. They're doing a major study for us, and it will lay out a blueprint for us to hopefully roll out a comprehensive population health plan focused on the social determinants, and I think it's going to make a real difference in the communities that we serve and keeping them healthier. So I'm really excited about it. I think it's going to be a major priority going forward.
Love that.
That's terrific. And we have to reinforce the fact that with the initiatives that you're talking about, with the expansion of Hackensack Meridian, this creates real jobs in our state. And so there's very much of an economic benefit here as well. Well, we have 7 minutes left, and so here comes the question that I think is particularly important. The governor of the great state of New Jersey, the CEO of the largest healthcare organization in the state, both of you have made enormous contributions to the healthcare area and industry. What would you like your legacy to be?
Oh, my Lord. I have a question for you. Linda, you're so good at this. Have you considered syndicating a show?
Only if you be my guest all the time.
You guys could take this on the road.
Good. I think we could. Get a warm-up act? I think we could. Listen, I don't know that I think a whole lot, all kidding aside, about legacy. I mean, we got elected to fix the economy, essentially, and that is a broad definition that includes the health and well-being of the 9 million folks who reside in this state. So we talk a lot about a stronger and fairer economy and state that works for everybody. We say a lot that we don't believe you can make economic progress without social progress, and likewise, you can't make social progress without economic progress. I get tagged as a pro-growth progressive. I'd take all of that. I mean, I think that's the space that's the lens through which that informs most of our actions in government. But in this specific, so that's a state that grows, and that it's fair. That inequities that have built up over decades, whether it's wealth disparity, whether it's across racial or gender lines, whether it's in our criminal justice system, whether it's the black maternal and infant mortality crisis that we referred to, where there's no, by the way, back to your sort of societal points, Bob, there's no, as you know, there's no one reason for that. It's a whole host of reasons. So, strengthening, growing this state, and shrinking the inequities sort of is at the core of what we are obsessed with doing. And a big part of that is what we're talking about today, that we continue to take great pride in having some of the best healthcare realities anywhere in the entire world, including hospitals, doctors, research, treatments, but that at the same time, we make that affordable and accessible, that it's a right, not a privilege, that continues to guide us, and that we accept the reality that Bob and his colleagues have, and I think that we have, that this is a whole of society challenge, that this is not just when you're in the doctor's office or in a hospital, but it's the sort of stuff that we've been talking about. So that's not a one tagline, bumper sticker legacy, but that sort of summarizes at least how we think about not just this space specifically, but about the broader journey that we're on in New Jersey.
And that vision of that holistic approach.
Agreed.
Thank you.
Agree. We cannot ignore that. That is a reality, and I think we should welcome that. I think New Jersey is as well positioned to play that holistic hand as any state in America.
Mm-hmm. Thank you, Governor. Bob?
Well, I guess as I talk about legacy, for the members of the press in the room, I hope they don't print the story that Bob Garrett's going to be retiring soon.
Yeah.
Just saying.
Nor that I'm going to be retiring soon either.
But at the risk of that, I guess that, Linda, the two areas that I think I'd like to think of in that regard, and this is certainly a team effort. This is not about Bob Garrett, but it's been a vision of ours for so long to establish this new school of medicine, something that I've been working on and others have been working on for much of their career, and to see it actually happen and actually make a huge difference in medical education and really change, I think, the trajectory for medical education, like those programs like community immersion and interprofessional academics that we've instituted, I think is a great legacy for Hackensack Meridian, for New Jersey, and hopefully for the nation. And then the other piece I would say, and we've talked a little bit about it, the governor and I and yourself, Linda, were talking about it, and it's a common theme from this morning, is behavioral health. Because I really do believe, hopefully the difference we're making in behavioral health will prove to be a legacy that we can all be proud of. Because if we don't think about it holistically, we're really not going to improve the health status of the communities that we serve. We're not going to improve the health status of our nation's population, or for the world, the global community for that matter. I think that's huge. And if we can do one thing with behavioral health, and that is once and for all to get rid of the stigma that exists around it and treat mental illness like any other chronic disease, like cancer or heart disease or diabetes, boy, I tell you what, that would be an amazing legacy right then and there.
Listen, I just have to say that. I love you for that. We have to stop treating behavioral health as a second-class citizen. And the stigma associated with it, amen. That's a great answer.
And again, huge economic implications.
No question.
So there's no question about that. I look out in the audience, and I know so many of you are in the healthcare industry, probably with this specific organization, and many of you have been with the industry for many, many years, perhaps decades. The evolution that you have witnessed must be extraordinary to you. I'm a layperson, and it's extraordinary to me. Yeah. So I think it's very clear that we have two enormously passionate leaders here, enormously committed leaders in this space, and I would like you all to join me in thanking them for their vision and leadership.
Thank you, Linda.
Thank you. And Governor, did you have any last words you wanted to share?
I'm good.
Okay, thank you.
Thank you all.
Thanks, everyone. Wow, we're a minute early.
Likewise. A minute under the gun.
No, you love that, huh? You'll be on time for your...
Ladies and gentlemen, thank you for joining us this morning.